Welcome to today's Health Spotlight, where we're discussing a sensitive but important topic, anal warts. We'll explore what they are, how they develop, and what you can do about them. Remember, this video is for informational purposes only and should not be considered medical advice. Always consult with a qualified healthcare professional for diagnosis and treatment. Anal warts are primarily caused by the human papillomavirus or HPV. Certain strains of HPV, particularly types 6 and 11, are most frequently responsible for these growths. HPV is a very common virus, and most people are exposed to it at some point in their lives. However, not everyone who is exposed will develop anal warts. The virus spreads through direct skin-to-skin contact, most often during anal sex. Less commonly, it can spread through other forms of sexual contact or even through non-sexual contact, although this is rare. Once HPV enters the body, it infects the skin cells in the anal region. The virus then hijacks the cell's machinery, causing the infected cells to multiply rapidly. This uncontrolled cell growth leads to the formation of visible warts. The incubation period. The time between HPV infection and the appearance of warts can range from a few weeks to several months, or even years. This makes it challenging to pinpoint the exact time and source of infection. Anal warts are a relatively common sexually transmitted infection. Accurate prevalence data can be difficult to obtain due to the sensitive nature of the condition and underreporting. However, it's estimated that a significant percentage of sexually active adults will be exposed to HPV at some point in their lives. Certain populations are at higher risk, including individuals who engage in unprotected anal sex, those with multiple sexual partners, and people with weakened immune systems, such as those with HIV or those undergoing immunosuppressant therapy. The signs and symptoms of anal warts can vary. Some people may not experience any symptoms at all, especially in the early stages. However, as the warts grow, they can become noticeable. Common symptoms include small, flesh-colored or gray growths in the anal area. These warts can be flat, raised, or cauliflower-like in appearance. They may be single or appear in clusters. Other possible symptoms include itching, bleeding, pain or discomfort in the anal region, and increased moisture around the anus. Diagnosis of anal warts typically involves a visual examination of the anal area by a healthcare professional. A doctor will look for the characteristic wart-like growths. In some cases, an anoscopy may be performed. This involves using a small, lighted scope to examine the anal canal more closely. A biopsy, where a small tissue sample is taken for laboratory analysis, may be necessary to confirm the diagnosis and rule out other conditions, especially if the warts are atypical in appearance or if there's suspicion of anal cancer. While we don't typically classify anal warts into distinct types, beyond the HPV strain that causes them, it's important to note that the size, number, and location of the warts can vary significantly from person to person. They can range from tiny, barely noticeable bumps to larger, more prominent growths. Some individuals may have only 1 or 2 warts, while others may have numerous clusters. The location can also vary, with warts appearing on the outside of the anus, inside the anal canal, or even on the surrounding skin. Treatment for anal warts aims to remove the existing warts and alleviate symptoms. However, it's important to remember that treatment doesn't eliminate the HPV virus from the body. Several treatment options are available, and the best choice depends on the size, number, and location of the warts. Topical medications, such as imiquimod or podophyllotoxin, can be applied directly to the warts. Surgical removal options include cryotherapy, which freezes the warts off, electrocautery, which uses heat to destroy the warts, laser therapy, and surgical excision. Your doctor will determine the most appropriate treatment approach for your specific situation. Regular follow-up appointments are crucial to monitor for recurrence. Prevention of anal warts primarily involves reducing the risk of HPV infection. The most effective way to prevent HPV infection is through vaccination. The HPV vaccine is recommended for adolescents and young adults. Practicing safe sex, including using condoms consistently during anal sex, can also reduce the risk of transmission. Regular screening for HPV and anal cancer, especially for individuals at higher risk, is also important. Discuss your risk factors and screening options with your healthcare provider. The prognosis for anal warts is generally good. While the warts can be bothersome and uncomfortable, they are not typically life-threatening. However, recurrence is common, even after successful treatment. Therefore, regular follow-up with a healthcare professional is essential. Recent research is focusing on developing more effective treatments for HPV infection and anal warts, as well as exploring new strategies for prevention and early detection. Some studies are investigating the potential role of the immune system in clearing HPV infection and preventing recurrence. Continuous advancements in research are offering hope for improved outcomes for individuals affected by anal warts.